Hi class, my name is Milan Collins and I will be presenting my community health promotion presentation for Nursing 370 for health promotion. So the problem is congestive heart failure among the African American patients. Congestive heart failure, also known as CHF, is when the heart cannot pump enough blood to meet metabolic demands. This can occur when the heart muscles are weaker than normal or when there's a defect in the heart that prevents normal circulation throughout the body. It is a chronic and progressive condition that severely affects one's quality of life, especially if it's not taken care of properly. It affects about 5.7 million people in the United States. It is common in people who are 65 years old or older, African Americans, people who are overweight, and people who have had a heart attack. Men have a higher rate of heart failure than women. According to the American Heart Association, the annual incidence of heart failure in whites is approximately 6 per 1,000 persons per year, while in African Americans it is 9.1 per 1,000 persons per year. African Americans have higher rates of hospital readmissions and socioeconomic factors, including lower income, limited disease awareness, inadequate access to health care, noncompliance with follow-up appointments, and poor adherence to recommended treatment like medication regime or diet and exercise. CHF continues to affect the community with its constant rise in prevalence and cost to the healthcare system. This supports the Millennium Goals as it pertains to promoting equality in health, reducing gender inequality, and increasing health education. Learning needs assessment. So current knowledge. It is important to build a rapport with the patient to promote a trusting relationship between the nurse and patient and encourage patients to verbalize questions and concerns. It is important as a nurse to actively listen to how the patient understands CHF and how it is treated. Gather all available data that will help to develop individualized teachings and health promotion plan. With any areas of misunderstanding or unclearness, educational reinforcement is necessary and should be provided. Learning style. Many people recognize that each person prefers different learning styles and techniques. Some people are auditory, visual learners. It is important for the nurse to assess learning needs and styles that are suitable to the patient's level of understanding. Assess barriers to learning, such as language, vision, and hearing, cultural beliefs and values, support system, and available resources. Family support system plays a very valuable role in helping to manage the care of individuals with chronic illnesses. The nurse should assess the family's knowledge of the patient's current healthcare status and how involved they may or may not be. Family and friends affect patients' self-management and often provide emotional supports that help the patient handle the stressors of their illness. Also, family can be the opposite. They could promote bad behavior like bad eating, no exercise, poor decisions in life. So the nurse also has to take that into consideration. Health promotion model. So Pender's health promotion model is appropriate model, in my opinion, for this specific case of African American patients with congestive heart failure to help decrease readmission to the hospital. It focuses on individual characteristics and experiences, behavior-specific cognitions and effect, and behavior outcomes. The theory notes that each person has a unique personal characteristic and experiences that affect subsequent actions. So individual characteristics and experiences prior to related behavior and personal factors. Question to ask is, what does a healthy lifestyle mean to the individual? Everyone will answer this differently according to their beliefs and values. Behavior-specific cognitions and effect. So this is perceived benefits of action, perceived barriers to action, perceived self-efficiency, activity-related effect, interpersonal influences, and situational influences. So what are the patient's beliefs, values, and understanding of their disease, in their opinion? What social norms are acceptable and unacceptable to them? Lastly, behavior outcomes. This is a commitment to a plan of action, immediate demands and preferences, and health promoting behaviors. So is the patient ready to change their life and commit to a plan? As nurses, we can help them, family can help them, but this all leaves it down to the patient themselves. They're the ones that can help themselves the most. Health promotion, health education plan. So the goal is to reduce the number of hospital readmissions among the African American population. Nurses do play a crucial role in providing acute care and outpatient care for patients with heart failure. Educating the community about chronic condition is vital. Education materials and resources should be free and readily available to access for all individuals, like pamphlets, CDs, online internet resources. Classes should also be offered at local community or clinic centers for those who are visual and auditory learners and want hands-on training. So a local community center can have a nurse come and show how to do blood pressure readings so that the patients with CHF can take their medications appropriately. In addition, education at discharge is so vital of improving outcomes in heart failure, as it promotes self-care, reduces readmissions, and helps patients identify problems early. Nurses should emphasize medication adherence, sodium and fluid restrictions, and recognize signs and symptoms that indicate progression of the disease, like shortness of breath, swelling or edema in the legs, fatigue, extreme tiredness. Daily physical activity and healthy eating habits should be encouraged, while also keeping it realistic to the patient. So follow-up appointments in person or phone should be in place 1 week after discharge. Make sure the patient understands the importance of the follow-up appointment, so make sure that they are at the appointment in person or answering their phone. It is important to give all the crucial resources to the patient so they continue on with care at home. Educate the patient to call their doctor or come into the emergency department if any signs or symptoms worsen. So research and evidence, I found 3 evidence-based practices that stood out to me. The first one is that in African Americans, the higher percentage of cases of heart failure is attributable to modified risk factors such as hypertension, hyperglycemia, left ventricle hypertrophy, and smoking, and fewer cases due to ischemic heart disease. So this is important to teach the community, especially with getting their blood pressure under control, getting their diabetes under control, with diet and exercise. Also, make sure smoking cessation is in place, because these are all factors that can contribute to heart failure. The second evidence-based article is about among African Americans younger than 30 years of age, the likelihood of developing heart failure over the ensuing 20 years is 20 times higher than whites. So this really stood out to me because I think education should be taught at a very young age, so they can already start putting in factors like eating healthy, exercising daily. It starts at a young age. So this is a crucial time of their lives. This is what, makes young kids adopt patterns that will go far beyond their year 30, 40, 50 years of age and older. So educating at a young age is extremely important. Lastly, also about exercise and how it actually helps with CHF. There's evidence to establish the efficiency of aerobic and resistive training for patients with CHF. Aerobic exercise was clinically shown to improve dyspnea work capacity and left ventricle function. Resistant exercise was also shown to improve left ventricular function, peak lactate levels, muscle strength, and muscle endurance. These results support the inclusion of aerobic exercise programs and resistant training for patients with CHF. So exercise is a crucial part of, properly caring for heart failure. Evaluation. So the health promotion model and teaching plan is an essential tool when evaluating the effectiveness of it. One method that we could use is to gather data to provide statistical information like demographics in a course of 6 months or less, maybe 3 to 6 months, to see if the rate of hospital readmissions among African American patients with CHF actually decreased after educational teachings and resources were provided in the community. Also, another way to evaluate is if follow-up appointments can be scheduled at a 3-month interval for a course of maybe 1 or 3 years to evaluate and record if the number of African American patients with CHF are understanding their condition and adhering to their medication regime, as well as proper diet and exercise. So these are great tools to evaluate effectiveness. So in conclusion, the way forward is a term that actually has to do with ethics in regards to increasing the nurses' awareness of ethics and ethical decision-making and clarifying the relationship between ethical thinking and effective nursing practice. So ethics should be an ongoing process of professional life rather than just something that's only discussed when a problem or an issue comes up. This is definitely the case for decreasing the amount of readmissions within the African American population diagnosed with CHF. This problem should not only be addressed when it just gets out of control, it should constantly be addressed and evaluated so that measures can be in place to help reduce the amount that the healthcare spends on readmissions. The issue may not be completely resolved, but we can make it better through a committed multidisciplinary team, educating the community and providing vital resources to those with chronic illnesses. This is my reference page, and thank you all for listening. Thank you so much.